Hi guys, in this video I will talk about Asperger's syndrome, its clinical manifestations and management. Asperger's syndrome was named after Viennese pediatrician Hans Asperger, who first explained it in the 1940s. Many researchers initially explained Asperger's syndrome as a milder form of autism and used the term high functioning autism for these cases. It is a neurodevelopmental disorder and comes under the umbrella term of autism spectrum disorder. Asperger's disorder was later identified as a separate disorder from autism in the 1990s. However, still many professionals consider Asperger's disorder a less severe form of autism. The potential causative factors for autism spectrum disorder are not established yet. However, abnormalities in the brain are thought to be the reason behind these disorders. These abnormalities may be genetic or environmental exposure to toxins, for example, chemicals or viruses. Boys are affected more than girls. Now coming to the clinical manifestations of Asperger's syndrome. Symptoms are less severe than other forms of autism. They have good verbal and intellectual skills as compared to language delays in autism cases. Individuals who have Asperger's disorder usually manage their day-to-day activities independently. They have minimum support needs regarding education and occupation. There are behavioral issues and the affected children find it difficult to communicate and interact with others. Their speech is monotonous and they lack facial expressions. They found difficulty in initiating or continuing a conversation. Stubborn and having fixed ideas and opinions, they strictly follow rules and routines. They quickly become agitated if their routines are disturbed. Abnormal reactions to sensory stimulation, either exaggerated or very low. They remain hyper-focused on certain activities of their interests. They appear socially awkward, clueless, have limited eye contact, and are inattentive. They do not understand social cues, body language, and gestures. They may have an obsession to collect junk material such as rocks or bottle caps. They may be skillful in information keeping, such as sports statistics, but scuffle with abstract ideas. Most of them possess average to above average intelligence and cognitive abilities. Children with Asperger's disorder frequently have delays in motor skills and may appear maladroit or uncooperative. There may be a lack of coordination in movement, because of which they may find difficulty in running, climbing, or riding a bicycle. Psychological issues may be present due to misplacement in society. How to diagnose a case of Asperger's syndrome? An assessment and comprehensive screening, including a developmental history and observation, is fundamental for diagnosis. Early diagnosis is important, as those who are diagnosed and managed in childhood have a better prognosis and chance of being academically and intellectually successful, hence living independently. The diagnostic criteria for Asperger's include: number 1, marked impairment in social interactions; number 2, repetitive patterns of behavior; and number 3, interest in activities that cause impairment in social, occupational, or other important areas of functioning. Differential diagnoses include attention deficit hyperactivity disorder, other neurodevelopmental conditions under autism spectrum disorder. Management of Asperger's syndrome. It is basically not a medical condition that requires conventional treatment, rather needs support at school, work, or in day-to-day function. Early intervention can provide them with social and behavioral tools to tackle the challenges they face in their lives. Multiple therapeutic approaches are recommended according to the individual's specific challenges, as no single therapy fits for all. For this purpose, a team of primary care doctors, pediatricians, psychologists, neurologists, speech therapists, physical therapists, occupational therapists, and social workers or teachers is involved in the management of Asperger's disorder. Some of the therapies which are required for the management of Asperger's disorder are mentioned below. Medical therapy, such as antidepressants and anxiolytics to manage mental health issues, behavioral therapy including cognitive behavioral therapy to help improve communication skills, emotional regulation and social interaction. CBT is a type of psychotherapy that can help improve behavior patterns and dissolute negative thinking. This encourages positive behaviors while mitigating negative behaviors. One of the forms of behavioral therapy is called applied behavior analysis, which is also beneficial for Asperger's disorder. Speech therapy, it is sometimes required to manage language and communication issues. It might improve voice control. Physical therapy and occupational therapy, these help improve motor skills, coordination of movements, and sensory issues among the individuals having difficulties in performing specific movements. Parental training and therapy is very helpful for parents in raising a child with autism spectrum disorder. It helps them to interact effectively and in a positive way with these children and hence builds good social and living skills. Social skills training. Training programs on social skills that address issues of social interactions, conversational challenges regarding understanding social cues and non-verbal cues, such as slang and facial expressions, are highly recommended for these children. These types of training help them to interact with others more effectively. There are other approaches that might help but not yet proven. These include melatonin for sleep disturbances. Music and art therapy could help with communication, behavioral, and social challenges faced by these individuals. Taking part in music activities in groups promotes behaviors like eye contact, taking turns, and interaction with others. Massage therapy may reduce anxiety or sensory issues. Acupuncture may be beneficial for social adaptation and sleep disorders among Asperger's patients. Support groups are highly recommended for children and adults with Asperger's along with their families. These offer an accessible environment to receive information and guidance about the disease management. Healthy, nutritious, and a balanced diet helps maintain overall well-being and overcome any other deficiencies that may enhance neurological deficit. Herbal remedies, neurofeedback therapy, which is use of electrical sensors to gain information about brain activity, animal therapy, which involves keeping pets for companionship and enhancing interactions, are all debatable for managing Asperger's disease, as no authentic information is available. Thank you for listening, and if you like the video, make sure to drop a like. Let me know if you have any suggestions in the comment